Stay on health-related matters because there are fears of a likely surge in COVID-19 cases in Ghana as cases are still being recorded at some health facilities across the country. Health experts are warning that the virus now presents itself like malaria symptoms, urging an uptake in the vaccine drive. My colleague Sarah Apenkro has more in the following report.
Following the announcement by the WHO that COVID-19 is no longer a public health emergency and a subsequent address by President Akufo-Addo on the state of the virus in the country, it appears many have let down their guards. Recent cases, according to authorities, are presented in different forms, so it is important that the country does not relax on its oars with interventions aimed at containing them.
I have had to isolate one of our staff nurses because she tested positive to COVID. Actually, somebody I hear came from, is it Canada or so, had burns, and if it were in times past, we would have closed down the burns unit. But when you're entering into areas that are congested, please still keep the mask on. In the hospital premises especially. So my nurses on the burns unit attended to this patient. He passed away. We do the COVID test and it's positive. So we've asked the rest to also test and maybe the reports will come to me and we'll see what happens.
Dr. Emmanuel Adipa Adapo, at a workshop for journalists on vaccine uptake in the country, addressed the seriousness of the issue.
Well, we have gotten to a point where in a democratic setting, for instance, many people believe that they have the right to their lives and the right to their bodies. But a lot also do not realize that that right usually ends where another man's right begins. So we have to be each other's keeper. I think we have begun to rest a bit on our oars in educating the public as to where we are. What we have to do right now is to still conscientize the populace.
Although there are no longer reports of severe cases, Ghana is yet to attain its herd immunity target for vaccination. Deputy Program Manager of the Expanded Program on Immunization, Naziru Tanko Mohammed, explained that it is important for people to get a booster jab at least every year to maintain immunity.
We still get a number of people who are still getting it. Because of that, there is still the need to continuously protect the population. And as we know, with virtually all the COVID-19 vaccines that we have, when you take it, you need to, from time to time, get boosters because the protection that you get from the initial doses that you take, the primary series we'll call it, actually wanes down with time. We are saying that for the normal population every year, you get your booster. For those that are at high risk, you ensure that from 6 to 12 months you get the boosters. So it's really, really critical.
As of March 2024, over 14,935,000 persons, representing 45% of Ghana's population, had received at least one dose of the COVID-19 vaccine. Also, over 11,850,000 persons are fully vaccinated, with over 6 million having received booster jabs. There are over 8 million doses of the COVID-19 vaccines currently available for the routine vaccination program to ensure everyone is protected.